All right, welcome back. Some bombshell health news this week as researchers have apparently found an association between the popular sleep supplement melatonin and negative health effects involving the heart. So we want to separate fact from fiction here, really break this down. So joining me to discuss the potential dangers of melatonin is Dr. Okwuosa of Rush University, who also sits on the Chicago Board of Directors for the American Heart Association. Dr. Okwuosa, thank you so much for taking time for us this morning. We appreciate it.
Thank you. Thanks for having me, Anthony.
Okay, so what exactly did this study find?
So this was a study of about 130,000 people. It's an international database. And the study looked at those that were on melatonin for a year or more, and they saw an association between melatonin use and risk of heart failure.
Okay, so an association here. I know that there can be confusion between an association and then cause and effect. So what category does this fall in? Is there causation here at all?
Not at all. So this is an association study. So the study shows it's an association. The causation would have to require a randomized controlled trial to actually monitor patients, put them on melatonin ahead of time, monitor them and make sure that the patients are equal at baseline, and then monitor them and see what happens. An association study just basically says this is associated with that, but does not describe what's in between. So for example, this particular study, like I said, found this association in 130,000 people, but the ultimate question that we have to ask ourselves is what's in between? So these patients, anybody that takes melatonin obviously has sleep disturbance at baseline. Right. And we know that those that have sleep disturbance, there's all the studies that have shown associations between sleep disturbance and risk of heart failure, risk of cardiovascular disease, risk of diabetes, obesity, cholesterol problems, depression, anxiety, death, accidents, lack of concentration, Alzheimer's, all of these things that are associated with sleep disturbance. And so I think that there's a lot that needs to be teased out and more studies that need to be done in order to tease out what we're seeing.
That makes total sense, because folks who suffer from insomnia, I mean, that's a cascade effect. It stands to reason that they have heart trouble as well. Okay, so doctor, if we do not suffer from insomnia, is it still okay to use melatonin?
Well, so usually we use melatonin. Melatonin helps us with the sleep-wake cycle. And the general idea is that if taking melatonin makes your body tricks your body into thinking at some point that it is nighttime and makes it easier for you to sleep. And so if you don't have insomnia, there should really be no reason to take melatonin. But I think that one thing I can say for sure is that there have been smaller studies that have looked at melatonin and its association with cardiovascular disease. Some studies have actually suggested benefits, believe it or not, in terms of cardiovascular disease, heart attacks, and so on with melatonin. But that notwithstanding, I think we need more studies to be done in this setting in order to understand a little bit more. Certainly, short-term melatonin appears to be reasonably safe based on the studies that we've seen. More studies need to be done to understand a little bit more both short-term and long-term.
Okay, so maybe some one-off use is okay if you know you're going to bed super early or something like that. It'd be okay to take melatonin kind of on a case-by-case basis?
It should be okay to take it case-by-case basis, but I will also emphasize that even long-term, there's a lot that we still need to understand. We don't know enough. And this study, again, just showed an association. We don't know enough about the long-term. And this should be an area of research. This will then create interest and hopefully create more basis for funding randomized control trials in order for us to understand more about melatonin, both short-term, understanding more short-term, and then again long-term as well.
That makes sense. So it's kind of a proceed with caution. Hey, here's a heads up. There might be something there. All right, Dr. Okwuosa from Rush University, thank you so much for breaking that down for us. We really appreciate it.
Thank you so much, Anthony. It's been a pleasure.